There's lots of places to access information post-surgery and resources. So there are publications put out by the GI Cancer Institute, which explains some information about surgery and your cancer diagnosis. There's also the Cancer Council has individual publications on individual cancers and diet, exercise during cancer. The other places to go is to the internet, obviously, and there is the Bowel Cancer Australia website. There's PanCare for pancreatic cancer. They all have lots of different information on exercise, diet, post-surgery. Another place that people often don't think of going to is if you've had some sort of pelvic surgery, so you've had rectal cancer or anal cancer. There's also Continence Australia that actually has some information on recovering post-bowel cancer. So there's lots of places where you can access information. Or you can ask one of your medical professionals where to direct you to find that information. Recovering from cancer is different for everybody. I think it's important to listen to your medical professionals, take their advice. Maybe if you're a person that exercises and goes to the gym on a regular basis, then take it slow. Don't go back into it full swing, particularly if you've just had surgery, you need to recover. If you're someone that doesn't normally exercise but feel like getting fit is important to you now, then you could be referred to an exercise physiologist for some support in ways to exercise and getting you started. There's benefits in being healthy and having a good weight to reduce the risk of cancer recurrence. Following a healthy diet, quitting smoking, all these things are beneficial in the long term to reduce the risk of cancer recurrence or developing another cancer. I think people need to realise that we talk about returning to normal, but I think post-cancer, maybe things won't ever return to normal and there is a new normal. So it's taking time to adjust to that new normal for you and what life is like. Some people choose not to return back to the life that they had, where the normal busy hustle and bustle, but actually take time out to actually enjoy their lives. So it's a time for reflection, and what that may be for you and what normal is may be different. So just accept that, take your time to recover. Support groups. Unfortunately, we don't have as many out there as that we would like for individual cancers. Luckily, patients with neuroendocrine tumours, there is lots of support groups out there. But for bowel cancer, your normal upper gastrointestinal cancers, where I am, there's no individual support groups. So support can be accessed through, there are some recovery programs that are run by the Cancer Council or by some of the psychologists or the social workers, individual centres to help people in moving forward and recovering from cancer. There is a buddy system through the Cancer Council where they will link you up with another person that's had a similar cancer, and that's through a phone support system. So I think it's just asking people what's out there. There are blogs. I'm not quite sure whether I could recommend them. I don't look at them myself, but I have heard patients have support through social media themselves. So having a look out there through social media and seeing what's there